Well, Mandela Bay Metro has been identified as a COVID-19 hotspot. Over 700 new cases were reported there over a 7-day period, bringing the province's total number of active cases to just over 1,300. Advisor to the Eastern Cape's Premier, Thobile Mben-gashe, joins us now to discuss the province's readiness and efforts to curb any further spread of the virus. Thanks for your time, sir. We appreciate it. So let's start with Nelson Mandela Bay. Of course, 700 new cases over the past couple of days. That must be worrying for one metro. How do you handle the situation, especially when it comes to being ready for hospitalizations?
That's good evening to you and good evening to the listeners. And I think it's true. Nelson Mandela has now been declared by the Premier as the hot spot and probably really an area that we needed to have a huge intervention. The Premier made a very distinct intervention. He will be sending a team to Nelson Mandela to really focus on a number of key areas. One, that the level of readiness that we get reports on a regular basis is actually to the level. We want to make sure that the issues around the COVID PPE, issues around the availability of oxygen, issues around the provisioning of all these equipments that are required to manage and provide services are available. But at the same time, we're pushing very hard to achieve the high levels of vaccination, especially amongst the elderly. And we are actually enforcing the NPI, the non-pharmaceutical interventions around masks and big crowds.
I'll get to the vaccines in a moment, but first let's talk about the third wave and monitoring people's behavior. We're seeing more and more people not using masks. It's something the President spoke about just recently as we approach the third wave. In terms of your monitoring and when it comes to police efforts, how is that working, especially in smaller towns in the Eastern Cape?
I think we have identified that there is a number of big areas. One, Nelson Mandela, Sarah Barkman, Krisani, and Zambe, and those towns where there's really an uptick and probably at alert levels in terms of numbers. What's important for us, again, we're closely looking in terms of the thresholds. What's important is that many of these towns are starting to find a kind of fatigue in using the non-pharmaceutical in terms of wearing masks. But I think there's still a very higher levels of adherence. We also found that we have areas like the areas around the garden route where there's a lot of people who are coming in from tourists. And we're a very unique system this time that many of the increases are happening in what is called affluent areas, in kind of the normal kind of old white areas in the city, which is quite creating a new dynamic in the way how we're dealing with the track and tracing and testing programs.
Yeah, so Nahal just a couple of weeks ago raised concerns about the Eastern Cape government trimming down the number of temporary treatment facilities. Have you addressed that concern? Is that something that's a reality?
Yes, we have addressed that. You'll recall that we had a large, what is called field hospital that has served us very well in the last last epidemic. We have now, we're decommissioning that, but we've really developed a lot of capacities in some of our TB hospitals. For instance, Nelson Mandela in the old TB hospital has got about 200 beds, and those beds now are dedicated to COVID. And there's another one in Huteneck that is also dedicated to COVID. We've also developed a number of beds at Livingston in the basement and new facilities at Doranginza. So I think from where you're looking in terms of capacities to deal with the patients that are coming in, we've built a lot of capacity. But what we're really focusing on, we're really trying to make sure that this epidemic and the surge in Nelson Mandela is controlled by making sure we're enforcing some of the level 2 restrictions and measures.
And of course, the one thing that workers often complain about is not getting proper PPE, especially when there's an influx of infections and hospitalizations. Are you making sure that that is happening?
Yes, we learned quite a lot last time. Remember, our big areas was oxygen. We've installed big oxygen tanks. We have also been dealing with the issues of PPE. We're responding that and develop the occupational health and safety teams that are actually monitoring their PPE on a daily basis. We've got what is called the visibilities of the PPE, stock visibilities, which we know on a daily basis what is available in each area. So I think we're feeling on the PPE we're okay. In terms of the oxygen supply, we're okay. In terms of the number of beds that have been repurposed for COVID, we're doing very well. I think we've been very lucky because we've been having this lull in terms of the lower numbers than other provinces, and we've already learned from Free State, Gauteng, and Northern Cape in terms of the surges.
Yeah. All right. Let's talk about the vaccines now. You've sent us information in terms of a graphic on the number of vaccinations that's taken place in the Eastern Cape. In the last 24 hours, and the date is the 7th of June, I see, you vaccinated 7,735 people in the Eastern Cape. Are you satisfied with that?
Yes, I think what's very important that the urban areas, that is Nelson Mandela and BCM, are actually doing very well. Our concern is the rural areas to reach them, especially with the restrictions and actually and covering them. The province to date has vaccinated over 132,000 individuals. I think where we're slow, and that slowness is really a function of the vaccine availabilities. In many instances, like last week, when the Premier was in the province, we ran out of vaccines. So I think the non-availability of the Johnson & Johnson is a problem. And the fact that we have actually determined some of the sites to be Pfizer-specific and Johnson & Johnson, and so we're starting to struggle because we're not having the Johnson & Johnson vaccine. So I think in terms of the uptake, especially with the elderly, we're doing it very well, and I think people are really responding to the vaccination program.
So how many doses of the Pfizer vaccine do you have readily available in the province right now?
What we usually have in terms of the Pfizer vaccines, we have about what is called a 30%. The province gets about 32,000 vaccines every once every Thursday, and the provisioning in relation to that is usually about 70% of the Johnson & Johnson and 30%, but we've been having more of the Pfizer vaccines now. So in terms of Pfizer vaccines, we've got sufficient, but we're running out of supplies. What we need is actually the Johnson & Johnson and probably more of the Pfizer vaccines.
Yeah, I get that. I know that the Johnson & Johnson one, because of storage, can be sent to rural areas, etc. What I'm trying to establish is if you have at maybe 32,000 doses of Pfizer, why have only 7,735 people been vaccinated over a 24-hour period?
That would be a daily number. That's not a total number of people that actually would have come in. So when we have that 32 has to, we use it for over a week. That's really the program. We don't use it all in one day. So what you'll be seeing, these are now time stamped for this week. And so we'll probably be using about 5,000 every day, and that will cover us about over 7,000. That will cover us about in 5 days we'll have about 35,000 of the vaccines being used, and then we get the next levels of vaccines.
All right, and then hopefully when we get the release of those 2 million doses sitting there in the Eastern Cape, which you should get a large amount from, are you preparing more vaccination sites then?
Yes, what we have done, we have actually started to relax many of the restrictions by actually making sure that we're doing a lot of what is called a very extended and fast-track accreditation of facilities. We've got over 2,300 vaccinators that are already actually there and ready to do the work. We have actually been holding back in opening up vaccine sites because of the demand. We don't want to create an unnecessary expectation. But all those sites are actually ready to be moved in. And there are a lot of other areas, both in terms of hospitals and some of the non-traditional sites that are actually ready. So we have geared ourselves, but we're really pacing ourselves in relation to the availability of the vaccines in terms of the program of National Department.
All right, we're going to leave it right there. Appreciate your time and your insight. Advisor to the Eastern Cape's Premier, Thobile Mben-gashe.